Hello, everyone. My name is Arlene Javier, and I'm one of the clinical nurse specialists for the Deteriorating patient team. Today, I'm going to walk you through how to complete a sepsis audit using Epic. The aim of this session is to show you how to identify the right patients, where to find the documentation, and how to extract the information needed for the audit tool. By the end of the session, you should feel more confident navigating Epic when reviewing sepsis management and deteriorating patients. This audit is done retrospectively. However, depending on how your ward conducts audits, you can also complete this prospectively by reviewing patients as they trigger on the ward. Both approaches are acceptable. It really depends on how your team prefers. This slide shows the sepsis audit tool that we will be completing. Currently, this audit sits within the nursing standards audit. This is a temporary process while we are waiting for Epic to develop a more robust dashboard to support sepsis auditing, which may take several months to complete. These are the key metrics we will be reviewing during the audit. Essentially, we are assessing whether the expected sepsis pathway actions took place, such as sepsis screening, nurses escalation, clinician response, and the sepsis 6 administration within an hour. All of the information needed for this audit will come directly from the Sepsis Navigator and Flowsheets documentation within Epic. To access the dashboard, first we navigate to the dashboard section, the one that has a bar graph icon, and from there we select the deteriorating patient dashboard. We can type it in the search button, and you may also store this as one of your favorites. This dashboard allows you to identify patients who have triggered high news scores, which makes it easier to generate an audit sample. To extract our sample, we will look for patients with a high news score or red patients and who have generated an OPA. Before doing this, please ensure that you select the correct department and the appropriate audit period, which is located at the top section of the board. This ensures that the patients you are reviewing are relevant to your ward or clinical area. Once the filters are set, we click the magnifying glass icon. This will open the slice and dicer, which allows us to explore the data in more detail. To view the list of patients clearly, you will need to change the visual display to the Detail tab. This will display individual patient records. A helpful tip here is to sort the patients list, as this can give you an idea of how many times a patient has triggered during their admission. This can help when selecting which patient to review for your audit. For this audit, we are only reviewing the first trigger that occurred while the patient was admitted to your ward. Unfortunately, the deteriorating patient dashboard does not allow us to open the patient chart directly. So what we need to do is to take the patient's MRN number and manually open the chart in patient station. A useful tip here is that once you open the patient station browser, you can place it side by side with the dashboard. This makes it much easier to copy the MRN number directly from the dashboard onto this patient station, rather than switching between screens. It's just a small step, but it makes the process much quicker. And once you have the MRN number, you go to patient station, enter it to open the patient's chart. From there, navigate to chart review and then select encounters. Then select the date of admission when the trigger occurred so that you are reviewing the correct episode of care. At the bottom of the chart, you will find the flowsheet section. Within this section, you can review historical documentation such as vital signs and components of the sepsis navigator. You can also access laboratory results, medications, and orders from this area, which is particularly helpful if you are reviewing the timeliness of the sepsis 6 bundle during your audit. This is where we will locate most of the information needed for the audit. Flowsheets contain historical documentation including vital signs, sepsis screening, escalation, and clinical response documentation. These elements are part of the Sepsis Navigator, which supports the sepsis management pathway. To confirm the first trigger on your ward, I usually begin by reviewing the patient's length of stay. You can do this by looking at the progress notes as well as reviewing the historical vital signs from the time that the patient arrived on the ward. Another helpful way to confirm this is by going to chart summary and then opening the event log. The event log allows you to review the patient's movement between wards, which helps identify how long the patient stayed in a specific ward and when the trigger occurred during that stay. This helps ensure that the trigger you are reviewing actually occurred while the patient was admitted in your area. In this example, the patient's first trigger on the ward occurred on the 22nd of February 2026 at 12 p.m., which we consider as our time zero for this audit. If you look at the sepsis screening, the patient was actually screened twice. However, the first screening completed at 12:03 on the same date is the one that we would record as a compliant for the audit. The nurse escalated the patient at 12:10, the doctor responded at 12:52, and all the elements of the sepsis 6 were completed by 12:51. If a patient is not appropriate for sepsis 6, we would still expect that the patient has been sepsis screened, escalated, and clinically reviewed. All of these steps can be documented within the Sepsis Navigator. This documentation is important because it demonstrates that sepsis was considered and appropriately ruled out. Using the Sepsis Navigator also helps improve the quality and consistency of our documentation, and importantly, it allows our practice to be measurable from a clinical outcomes perspective. When a patient begins to trigger with a high news score, we would expect to see a sepsis screening, nurse's escalation, and appropriate clinical response. All of this should be documented within the Sepsis Navigator or flow sheets. And this information is what we use to complete the Sepsis Audit tool. This slide tells you as to where we usually find the information within Epic. So from here, select the Deteriorating patient dashboard, which allows identification of patients who may be clinically deteriorating. On this dashboard, we focus on patients with high news scores or red triggers, as these indicate individuals who may require urgent clinical review or escalations. Once a patient is a bit identified, open the Slice and Dicer. Within the Slice and Dicer, change the view to Detail View. This allows more specific patient level information to be displayed rather than the summary review. Then manually access the patient chart using the MRN. When the chart opens, review the flow sheets and clinical documentation to understand the patient's observation and timeline of deterioration. One key step is identifying the first trigger, particularly where deterioration first occurred on the ward. Following this, review documentation to determine whether sepsis screening was completed and whether appropriate escalation and clinical response took place. This process helps identify when deterioration was recognized and whether it was managed in a timely and appropriate way. And finally, recorded information in the sepsis audit tool.